Welcome everyone. Today we are going to understand Roseola Infantum, also known as Exanthem subitum or the sixth disease, using this visual mnemonic story. Instead of memorizing scattered pediatric facts, we will decode this image step by step. Every object in this scene represents an important clinical exam point. Let's begin. The Kingdom of Roseola. Imagine entering a magical kingdom called the realm of King Roseola Infantum. At the center of the kingdom sits a young infant king wearing a crown made of roses. This character represents the disease Roseola Infantum. The word rose, Roseola, and the infant king reminds us that this disease primarily affects young children, usually between 6 months and 2 years of age. So the rose-crowned infant king anchors the diagnosis. Backhand index pointing right, Roseola Infantum, a childhood viral illness. The virus behind the disease. Now look to the side of the throne. You will see a strange rose-colored octopus holding a sign labeled 6. This creature represents the virus responsible for the disease. Backhand index pointing right, human herpes virus 6, HHV6. The octopus symbolizes a virus, and the number 6 reminds us that Roseola is also called the sixth disease. So remember, backhand index pointing right, Roseola Infantum is caused by HHV6, the sudden fever. Now look behind the infant king. There is a volcano erupting with molten rose-colored lava. This volcano represents the sudden high fever that occurs in Roseola. Children with Roseola develop abrupt high fever, often reaching 39 to 40 degrees Celsius. This fever can last for 3 to 5 days, and in some children it may even trigger febrile seizures. So the rose fever volcano symbolizes backhand index pointing right, sudden high fever, the unique course of the disease. Now notice the funnel-shaped shoot labeled fever dropping. This shoot shows something very important. In Roseola, the rash does not appear during the fever. Instead, the fever suddenly drops, and then the rash appears. This is a classic distinguishing feature. So the sequence is backhand index pointing right, high fever, first fever subsides, rash appears. This unusual timing is why the disease is also called Exanthem subitum, meaning sudden rash. The characteristic rash. Now look at the infant king's skin. You can see rose-colored spots appearing on the body. These represent the typical rash of Roseola. The rash is maculopapular, rose-pink in color,
non itchy,
blanching. Notice how the image shows the rash starting on the trunk. This is another key clue. The rash usually begins on the trunk and then spreads to the
neck,
face, arms, legs. So remember, backhand index pointing right, Roseola rash starts on the trunk and spreads outward. The blanching feature. Now look at the pool of rose-colored water labeled blanching rose pool. This represents another clinical feature. If you press on the rash, the color temporarily fades. This is called blanching. So the pool reminds us that the rash is backhand index pointing right, blanching maculopapular rash. Nagayama spots. Now look closely at the lower part of the image. You will see a two-headed serpent pointing toward the uvula. This represents a specific, but lesser-known clinical sign. Backhand index pointing right, Nagayama spots. These are small red lesions or ulcers on the soft palate or uvula. They are sometimes seen in children with Roseola. So the serpent pointing to the uvula helps us remember. Backhand index pointing right, Nagayama spots may be present. Separation of fever and rash. Now notice the sign that says differentials. Fever and rash are separated. This is extremely important clinically. In many childhood infections like measles or rubella, the rash appears while fever is still present. But in Roseola, something unique happens. Backhand index pointing right, fever disappears first, and only then the rash appears. This clear separation of fever and rash helps doctors distinguish Roseola from other viral illnesses. Age group. Finally, look at the sign at the bottom of the image. It says, common in children 6 months to 2 years. This is the typical age group affected by Roseola. The reason is that infants lose maternal antibodies during this period, making them susceptible to infection.
Quick summary.
Now, let's bring everything together. The rose-crowned infant king represents Roseola Infantum. The HHV, 6-rose octopus, represents the causative virus. The rose fever volcano represents sudden high fever. The fever-dropping shoot reminds us that rash appears after fever subsides. The rose spots on the trunk represent the maculopapular rash starting on the trunk. The blanching rose pool represents the blanching rash. The serpent pointing to the uvula represents Nagayama spots. And the childhood kingdom setting reminds us that this disease occurs mostly in infants and toddlers. Final recall trick. So the next time you hear Roseola Infantum, imagine this scene. A rose-crowned baby king, a HHV, 6 octopus holding the number 6, a volcano of sudden fever, and a rash that appears only after the fever disappears. With this single visual story, you can recall the entire clinical picture of Roseola Infantum.